Hey, what's up, guys? So, you ever hear someone say that nursing home nurses do not have any skills? That's what I want to talk to you today about, okay? My name is Bilkis Sally. It is your favorite nurse leader. And I want to talk about one of the main misconceptions that I want to clear up, all right? So, if you know me, you know I started out my career as an LPN and, worked my way up the ladder, blah, 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 right? But one of the things that I'm noticing is that, and I'm still hearing, and I must admit, I was one of those people also. Okay, when I first started my career, I used to always say I had to be in the acute care setting because I didn't want to. I wanted to make sure I gained skills, and I didn't want to lose those little bit of skills that I did have starting out. Okay, but what I've learned is one. I did love working in the acute care setting, and I talk about it in the other video. And I did take that route just because I knew working in the clinical setting that I knew I needed to have the clinically, I need to be clinically sound in order to be able to care for a variety of patients. But what I'm noticing is that this is actually stopping people from applying to our facilities. So I want to just clear this up. One, in order to be a nursing home nurse, you have got to be clinically sound, honey, because we do not have the luxury of having everybody on standby, okay? For one, you are the eyes for the doctor, okay? Meaning anything goes wrong with that patient, you have to be able to tell that doctor what you're seeing in order for that doctor to really provide the services that that patient needs, okay? Number two, you have to be able to identify those changing conditions and you have to be able to identify those promptly. Okay. Number three, when you have those code blues, baby, when somebody goes into cardiac arrest, there is not everybody coming to the team with the respiratory therapists and the doctors. Honey, it is moi, the nurses and the nurses team. And we're running those codes, which is why I always tell my nurses make sure that they run their code drills. So no, our nurses are very clinically sound. And like I said, I am getting nurses now that are coming from the acute care setting and are now coming into long-term care, which I think is great because we are getting TPNs. We have dialysis in our facilities. Not only do we just have that, we have like IV therapy, we have wounds, okay, stage 4, just we're packing multiple type of wounds, and don't forget we deal with a lot of behaviors without restraints. Without restraints. So we have to know how to function from a clinical level in these nursing homes. All right. So I don't want this to inhibit nurses from applying for an LPN job, okay, or going to be an RN supervisor. The difference is when you get into that RN supervisor position, baby, you're it. This is why I always say the more skill you have, the better, because you will know how to act in a emergent situation. However, that doesn't mean that you don't gain skill while you're there, okay, because your nursing homes get a little bit of everything. Okay, so you're going to learn how to insert a Foley. You're going to learn how to draw blood. You're going to know how to access IV. You're going to know all about types of peg tubes. Know how to reinsert your trach when that patient pulls it back out. All right. So we gain so much skills while we're working in a nursing home setting. So I just wanted to clear that up. All right. I must admit, like I said, I was one of those nurses starting out. Okay, but that was when I was like a new nurse, and I was like, ooh, I want to make sure I'm clinically, but I still went to the nursing home, and that nursing home, baby, I learned time. That's why I learned my time management. That's where I learned my prioritization. That would let me to be a better nurse working in the acute care setting because I had mastered time management and prioritization and knowing what I needed to do first, second, and third. And then when I went back to long-term care, I was able to then add more value and how I assess my patients when I notice those changing conditions. But please do not let that prevent you from working in the nursing home. All right, I promise you, you will gain skill, baby, working in the nursing home. All right, because we got to figure it out ourselves, and we have a lot of responsibilities working in the nursing homes, whether we be the DON, the RN supervisor, the unit manager, the charge nurse, even the CNAs. We all have a lot of responsibilities in these roles in the nursing home. Okay, so don't let that inhibit you. Come on over. I promise you, you'll love it. I didn't think I would. It's an acquired field, all right, but it's a wonderful field. All right, I absolutely love it, which is why I'm still here almost 2 decades later. All right, so I just wanted to clear the air. Don't think that you're going to go into a nursing home and lose your skills. You're not. All right, like, comment, and as always, subscribe and follow for more tips. All right, have a great day.